And when the brain is trying to think about utilizing a limb that's not there and it can't do it, that often manifests as pain. With a desensitization protocol, there are no medications that are involved and it can only help. It can't hurt.
After limb amputation, dogs and cats experience both general pain and nerve pain. What's the difference? And how can sensory re-education help? Find out with Ilaria Borghese on this episode of Tripawd Talkk Radio.
And scratching like a three-legged dog.
For any tripod, cat or dog.
Why do some vets do things that way? Why?
So many people don't realize that their dogs are in pain.
He's a three-legged dog and he's still pretty good. Three-legged dog.
Hello, it's Jim and Rene from Tripawds again, back with Tripawd Talkk Radio episode number 124. Have you ever noticed your cat or dog's muscles twitching near the incision site during recovery from amputation surgery? Or have they ever jumped up with a sudden yelp, maybe even weeks later? These are common signs of nerve pain and phantom limb pain. Gabapentin and other pain medications are often prescribed to address this. But what exactly is nerve pain? And how can sensory re-education help? Ilaria Borghese is the creator of the TheraPaw orthopedic dog boot and founder of VitalVet, an amazing resource for all special needs pets. And we're excited to have her on the show today. Ilaria talks with Rene to help us understand the difference between general pain and nerve pain. We discuss phantom pain and muscle memory, and she explains how the desensitization protocol can help rewire the brain after limb amputation without additional medication. Ilaria walks us through sensory re-education with simple, practical steps you can take to aid in your pet's amputation recovery and nerve pain management. Check the show notes for links to more helpful information, and be sure to take your own notes as we learn what you can do at home to help relieve pain for your dog or cat. Ilaria, thanks so much for joining us today.
Oh, thank you so much for being here. I'm thrilled and very honored. Very.
Well, we are too, Ilaria. This is Rene, and I have been wanting to meet you for a long time because our community has been really familiar with your work ever since TheraPaw and now VitalVet and all of the work that you do to help special needs animals. Please, for those who are unfamiliar with your background, can you give us a snapshot of what you have been doing in the animal community?
Sure. I actually started out as an occupational therapist working with predominantly with children, but I had a lot of dogs. And as an occupational therapist, what we're trained to do is we actually help people accomplish their daily tasks. So whereas physical therapists help people get from point A to point B, be it with crutches or wheelchairs or a walker, occupational therapists actually help people accomplish the task once they get there. So it's bathing, dressing, feeding themselves, toileting, the whole 9 yards. So occupational therapists are very well versed in assistive devices, adaptive equipment, making braces, that type of thing. So when my animals started to get injured because they were crazy greyhounds off the track and we had a great time in the backyard, but there were a few injuries that they sustained, I wasn't really thrilled with what was available for them back then. So I started bringing some things home from my human practice, and I started to formulate some things for them. So I started to make thermoplastic splints for them whenever they had a sprain or a fracture, where instead of having to cast them, I could have them splinted so that I could do some range of motion or some massage for them. I had several greyhounds that had foot problems, so I developed the TheraPaw boot, which was the first product that I developed. And so once I started developing these products for my dogs, then, the floodgates opened and people started asking me for similar products. So I started manufacturing those products. And then the next thing that happened was that people were asking me for things that were either already on the market or things that I did not have developed yet. So, hey, my dog had his limb partially amputated. Can you make me a prosthetic? No, I can't. But I know several companies that can, and here they are. So I was always referring people out to all of these different companies, and many of them were small. They had started out in human practice like I had, and they had developed a product or a couple of products for their own pets, and that grew into a little niche market that they had. But all of these companies were spread out all over the globe, basically. I knew them. I knew a lot of them because I'd gone to conferences and I'd met with them, and I knew and I knew from my dealings in working with animals with special needs how many companies were out there. And I was wanting to get a resource to have all of these companies put under one umbrella. And that's where VitalVet came in. So VitalVet is basically all rehab, assistive fitness products for animals with special needs, whether it be weight loss and weight management to senior pets that are having issues with like mobility or dogs with injuries like amputation. So everything's under one umbrella. All of those websites are there. They're not just our products, it's everybody's products under one umbrella. You can find it under VitalVet. And it also helps veterinarians as well, because let's say a dog is looking for a prosthetic, a pet parent is looking for a prosthetic for their pet. There are several prosthetics companies out there. And so the veterinarians can look through all of those prosthetics companies. Now they're all under one umbrella right there. Prosthetics, there they are. Those are all the companies that make prostheses for dogs. And then they can review all of their choices with the pet parent, and they both can get together and make the best choice for them and for the animal. So
yeah, I love that. I love that about VitalVet. Sorry to interrupt, but I'm just so excited to have you. It's interesting how so many people have come from the human space into the veterinary space, and that's what's driven all this innovation since we started Tripawds. And I think TheraPaw has been around a long time. When did you start?
So TheraPaw started in 2001.
Yeah, see, that was before
with the
Tripawds.
dog boot. Yeah, and as a matter of fact, I dealt with my own amputations. They were toe amputations. So my greyhounds had several of them had corns in their toes, and the way it was dealt with back then was to amputate the toe. Well, you amputate the toe, you get rid of the corn, but then a corn or a callus develops on the other weight-bearing toe, and then there was a point where I didn't know any better. And I had one dog who had the 3 toes on his back foot amputated. So he only had one weight-bearing toe, which was his outer toe, which was the smallest toe that he had. And his whole foot was a mess, and he just couldn't utilize it. I mean, it was not functional. So I ended up making him not only. At that time, I already had a TheraPaw boot, but I ended up making him a big, thick sheepskin slipper for indoor use because he couldn't even use his foot inside. He couldn't even weight bear just with his little toe. So, yeah. So TheraPaw has been around for quite some time, and it was that first product that I had made for my dogs with toe amputations that were only comfortable on the carpet or grass. And at that time, I was actually living in New York City. So you can imagine how little both there was.
Yeah.
So, yeah. And so from there, it turned out to, the TheraPaw boot is really heavily padded and thick at the bottom. So then this neurologist, who as a local neurologist said, "Oh, I'd like to order some boots for my practice." And I said, "Why? Why are you ordering the TheraPaw boots?" And he said, "Well, for our dogs with sciatic nerve injury that are dragging their back legs." And I said, "But, TheraPaw's protection is at the bottom, and these dogs are dragging, so they're abrading the top of their foot." And he said, "Aha, I have the answer. I flipped the TheraPaw boot upside down, so the tough part is on the top of the foot." And I have this whole vision of this dog dragging its leg with the boot on, and yes, it's protecting the foot, but it was totally not functional. And my occupational therapy mind went crazy and said, that's not functional at all. We have to fix this problem. So with that boot came, the dorsiflex assist, which is basically elastic straps that help to pull the foot up and position the foot properly so that a dog with sciatic nerve injury can actually have assistance in placing their foot. And that's where the dorsiflex assist came in, and then it went from there. So those were,
Yeah, and it's interesting because the Dorsey assist, I just sent somebody over there today because their dog had a spinal embolism and recovered enough, but is still dragging the leg. And this is not a tripod, but the vet's talking about amputation. And I just said, have you tried this device? And I sent her over to TheraPaw. But so you've done like incredible work in this space with special needs pets. And one of the articles that you wrote caught my eye because it's talking about nerve pain. And for everybody listening, we will have a link to the article in the blog post about this. But let's talk about nerve pain. That's really what the show is going to be about. People get their dog's leg amputated, and we pet parents don't realize these are nerves that get severed, and these are nerves that are angry. They don't know what to do with themselves once that leg is gone. We come home. If we're lucky, we get Gabapentin and it helps. Sometimes it doesn't. Sometimes it does. But let's talk about what amputation does to the nerves and how it may or may not affect animals after amputation surgery.
Sure. So it all goes back to the brain and how the brain projects, what the image of the body is on the brain, because the brain doesn't really see what the body is. The brain actually develops a picture of the body based on sensation, based on feeling. And a perfect example of that is when a baby's born. Baby's crying, their whole sensory system is gone awry. They're just born, and what do people do? They swaddle the baby. They put a nice, blanket over it and swaddle it. And what that does is that allows a lot of sensation throughout the entire body. And that helps to calm the nervous system and calm the brain down and say, oh, okay, my body is in this tight little space right here. It's not all over the place. And it helps to calm the nerves that way too. So it helps the brain to formulate a picture of where the body is in space. And that helps to calm the nerves and helps to decrease pain. So as the child or the puppy, grows up, they know where their body is in space because of all of the impact that the body is receiving when the body is moving through space. So when a limb is amputated, the brain has no idea that limb is gone, none whatsoever, because the brain has a mental map of what that body looks like in the brain, and it has no idea that the limb is amputated. So the brain has to relearn where that body starts and ends. Now it ends a little bit differently. And so what happens is the brain is saying, okay, let's say the dog's right forelimb was amputated. Okay, right forelimb, move. Well, what do you mean you can't move? You don't have a right forelimb. And the brain has no concept of that at all. So the brain is trying to move the right forelimb. The right forelimb isn't moving because it's absent. And the brain sort of goes on a short circuit. And that actually can manifest itself as pain. So the brain is actually in pain because it doesn't know where its body is in space because it's gone. So that is a part of the equation. The other part of the equation, of course, is also at the surgical site, the nerves are damaged, the nerves are severed, and that causes a lot of discomfort and pain as well. So one of the things that, so with amputation, the brain's body picture is distorted. Okay.
Really distorted.
And it no longer matches what the brain thinks the body looks like. And so what we try to do with a a desensitization and a sensory reorganization type of protocol is to try to reteach the brain where the body is now. So the body no longer has this limb. Brain, you have to, keep up with the program here and understand that now, I don't have this limb anymore, and this is where my body ends.
This is so fascinating to me because in all of our years of doing tripods, this is something that hasn't been discussed with veterinarians that we've talked to, or really anybody, rehab therapists. But it's such a major part of the recovery, this desensitization
Sensitization
process.
Mouthful, isn't it?
It is.
Desensitize the nerves. There you go.
Yes. And so we have two areas that we're having to do this to: the incision site and the area where the missing leg was. So we're approaching it from two angles. Now, normally we think that gabapentin will take care of this. Boom, we go home with it. It's supposed to help. Why does it not always work? And what can we do to help it work?
Okay, so let's go back a little bit. So when the amputation first occurs, the brain hasn't caught up with the fact that the limb is no longer there, and so it starts to send out signals, and the signals are going nowhere, and so that manifests itself as pain. Sometimes it's all, it depends. Dogs react differently. Sometimes, dogs kind of recover as the wound starts to recover. Mm-hmm. And because the wound is being managed, you're getting a lot of sensation in that area where the wound is being managed. It's being cleaned. It's being rebandaged. So all of that is sensation into that amputated portion, and that is helping the brain sort of reformulate the picture of what the body looks like. But sometimes it takes longer. Mm-hmm. And so that's where gabapentin comes in. And as we all know, sometimes medications work on some dogs and not others. And sometimes it just, it's kind of hit or miss. So you try it and see if it helps. But with a desensitization protocol, there are no medications that are involved, and it can only help. It can't hurt.
That's what I love about this.
Not only that, it helps the process along, and it also helps to maybe reduce the sensation, reduce the time that the animal spends in pain, and also helps with healing. Because the more sensory input you can get into that area that's been damaged, the faster the brain recovers. And when the brain recovers, the body recovers faster too.
What I really love about this process that you'll describe today is that it's not woo-woo. So it's not hands-on. Forgive me. Reiki can be really wonderful. But I think that in a case like this, when an animal is in a lot of pain, Reiki may not always be the answer. Therapies like that, hands-on healing, that sort of thing. It can only, like you said, it can help, it can't hurt, but I'd like to do something more effective. And when I hear about a dog that's screaming out in pain, or we get this a lot where a cat will start walking backwards suddenly, like they're trying to get away from their missing leg. Generally, this kind of thing happens shortly after they come home, but sometimes it happens weeks, even a couple of months later, where an animal will start jumping up all of a sudden, like they just got an electric shock. Yeah. And from my conversations with human amputees, phantom pain is pretty much identical in non-human animals as it is in human animals. Is phantom pain always nerve pain? Is nerve pain always phantom pain, or are there different types?
It's sort of a general broad category because it does present in different ways. So when you're looking at signs of pain in general pain can manifest as anxiety or nervousness. It can manifest as fear. It can manifest in changes in behavior, like the animal doesn't want to eat, or the animal, is whining or crying. But when you're looking at nerve pain specifically, and when you're talking about nerve pain, so that actually looks little different. You'll have excessive licking at the site of the injury or gnawing at the level of the injury, and you'll have overreaction to stimuli or touch. So so that when you're talking about that cat jumping up like it was on an electric shock, a lot of that overreaction is just one tiny little thing that can feel like pins and needles. Now, you and I understand, let's say if we sit down for a long time with our legs in a certain position, we get up and we get all that pins and needles sensation, and you and I can make sense of that. It doesn't make sense to an animal at all. So a lot of those pins and needles can be very distressful for an animal, and not only that, because the brain hasn't figured out that the limb isn't there yet, they're trying to utilize it, and that just becomes sort of this, it can be quite scary to see an animal trying to figure out how to use its body, and it just can't figure that out just yet, and it's a painful thing. So when the brain is trying to think about utilizing a limb that's not there and it can't do it, that often manifests as pain. The brain will register that as pain because it's unable to move that part of the body. So when you're talking about phantom limb pain, it's sort of this general category that can manifest itself as like a slight overreaction to stimuli, to all of a sudden an animal thinking that its limb is there and trying to utilize it and going crashing, nose diving into the ground. So it's this whole thing about the body, again, not realizing that the limb is there. And that manifests itself from, it's got a whole spectrum of how it can manifest depending on where the pet is in their level of recovery.
That is really good to know. I've always been curious about that. And so in our community, we just typically call it phantom pain. But it is very distressing for the pet parent.
Yeah.
We tend to read about it, but until you actually see an animal try to use their stump, sometimes, and when vets leave a long residual limb, that's really distressing for pet parents to see. If they get a clean amputation with the scapula and everything, you really don't see the muscles twitching or anything like that. But is a muscle twitch the same as pain?
It can be. Certainly muscle twitches are a hallmark of pain. So when you're using your fingers and you're going down the spinal column, and you'll see the back muscles kind of twitch, that's areas of tightness or tenderness in an animal. When you see muscle twitching, it can be pain, and it can also be residual nerve, firing, trying to get a muscle to work that's no longer there.
Interesting. Our dog Wyatt had a mid-femoral amputation, and so he had quite a bit of muscle tissue left. And even at 10 years old, occasionally we would see his muscle just like start twitching for no reason. Didn't seem to bother him, so I'm going to assume that he was never in pain from that specifically. But it really freaks people out. And had I known about your sensory re-education process, I would have done that to him long ago. Can you tell us more about that process and what we can do from the time that we bring our dog or cat home from the vet until later in life, like with Wyatt, if I saw that kind of twitching going on? How does it work?
Sure. And, with muscles, it's not just... it's not just their end range. They have a beginning and an end. So when you see him, even though he had a mid-femur amputation, that muscle still had connection at the humeral level. So that's where that twitching's coming in, and that he's probably still trying to utilize that limb to some degree, or there's some residual memory of how that limb used to be. It's sort of like, muscle memory, like they talk about with sports. It's just a habit where that muscle's always wanted to move because that's what he used to use that leg.
Yeah, we see that a lot with dogs who have a back leg amputation. They try to do what we call air scratching, and they'll take the missing leg and start to try to scratch their ears. Yeah, it's like the saddest thing in the world. We always had a back scratcher handy for Wyatt.
Yeah. It takes a little while. Yeah.
Yeah. So this process, how does it work?
So what you're trying to do is, it's easier to understand if let's say you have a dog with a nerve injury. Okay, so you have a dog with a nerve injury that's not an amputee. And what does the veterinarian do? So the dog, let's say, is dragging its leg. So, and it's abrading its foot. The pet parent might bring him into the vet. The vet will say, well, it takes a while for nerves to regenerate. Let's go ahead and bandage the leg to protect the leg. And then we'll see if we get regeneration in a month or two, and then we'll see where we're at. But what happens when you bandage the leg is, yes, you're protecting that limb, but you're also absolutely just completely you're covering it so it doesn't get any sensation whatsoever. And the way you actually help nerve to regenerate is to just to flood the system with sensory input to get sensation into that limb, into that place where the nerves have been injured, because the nerves are saying, I'm injured, I'm not quite sure how to react to the environment, and all of a sudden you're just wanting to bandage the leg, and it's not getting any information. So what you want to do is you want to add sensation, add stimuli to that limb, to allow the nerves to get the information that they need in order to heal. So when a limb gets amputated, you're going to have that stump area that may be hypersensitive and that may have sort of odd type of sensations to it. So what you want to do is you want to flood that area with sensation. You want to say, hey, brain, this is where my body ends in space. And so therefore, I'm going to make sure that you understand what that feels like. And what you want to do is you want to basically flood the system with as much information as possible. And what happens when we walk around during our daily, during the day, we get all kinds of environmental stimuli. We get soft, we'll put on some nice soft slippers. We get something harder, we take off our shoes and walk on the sand. We get something cold, like the cold water. We get something hot, like when we go into the bathtub. So our system is always getting flooded with all kinds of sensations. It's something rough like the sand, and something soft like our socks or our slippers. So that's the same type of thing that you want to do to that stump area, is you want to flood it with sensation. But because it's hypersensitive, you have to be really careful about how you proceed. And you want to go from the mildest, softest, lightest things and the lightest touch to something that's a little bit more rougher and longer duration and more sensory input. So you never want it to be painful. And you never want it to be, you never want your dog to be anxious about it. You never want your dog to be painful. This is not that type of reaction where you're sort of forcing a stimuli on the dog. You actually want it to be a nice, easy transition from one stimuli to another, and also from different temperatures, different materials, different sensations like vibration. So when we look at the protocol that we developed for the article, and actually we refined it, we'll go from from the lightest, which could be like introducing a piece of chenille or a piece of fleece on that stump area and petting them lightly with it. And what I always recommend is before you go to that stump area, you do the same with the other leg, the non-missing leg, right? And even though it's not missing, and even though you can't get into that whole stump area, let's say it's their front limb, rub their shoulder with the chenille first, okay? And then go over to that stump area shoulder and then rub that shoulder with the chenille so that both sides start to feel the same. And then you progress to something that's a little bit more abrasive. Then you'll go to something like a terry cloth, which has few little nubs on it. And you don't want to do anything too drastic. So you want to move from something like chenille or a fleece to a terry cloth. You might then step up if the dog's okay with that. You might even step up to something like a burlap.
Wow.
But this is done through, a period of time. So for, let's say, the phase 1, which would be our first phase where we get started, we are going to start with the chenille, something that's really soft. So take a piece of chenille, rub their non-amputated portion of their leg with it, and then go to the amputated side, the same place, and then rub the chenille on that side. Make sure that they're comfortable with both. Wait and just do it for a few seconds. Nothing too harsh, nothing that the animal's not comfortable with. Just do it a few seconds. Remember, your dog is always your pet is always with you. So you don't have to force the therapy on them right away. Just start for a little bit. And then if they move away or if they look uncomfortable, come back to it maybe 5 minutes later, 15 minutes later, half an hour later. There's no pressure. This is not, you have to do it right away and they have to get this treatment, 5 times a day for 15 minutes at a time, or it's not going to work. Just take it easy with your dog. This should all be a very comfortable process. The next thing that you would probably want to do is you would probably want to use some kind of a brush. So you go from a chenille, and the brush, I would actually use maybe like a cotton wand. That's as abrasive as I would get. So go from something that's really soft like chenille to maybe a cotton wand. Rub their unaffected, their non-amputated side first, their shoulder, then go back to the amputated side with the cotton wand. And then I would, and everybody has this tool, I would use my hands. Rub, nice light touch, rub their unaffected side first, and then rub their affected side. Pressure. You don't want to do anything that's like tickly, because that's always a noxious thing, so you don't want to do a light tickle, because that is a noxious or uncomfortable stimuli, no matter where you do it, right? So you just want some light pressure on, let's say, the shoulder area of the limb that's not amputated, and then go to the amputated side and do the same pressure on that side. And then that would be all for phase 1. And I would probably do that for a couple of times a day. Again, this protocol is going to take you what? If you apply all of those stimuli all at once, it's going to take you a minute and a half at the most, right? I would do that maybe 5 times a day. You're going to be petting your dog anyway. You might as well make it functional, right? So if you're going to go and sit down and pet your dog and tell him he's okay, why don't you grab a piece of chenille and start doing some of that protocol? And why don't you grab a cotton wand and start doing that protocol? And maybe you can even associate it with some treats, and something that's positive. Once the dog is comfortable with phase 1, then you can easily move on to phase 2. And so then you go from the chenille, then it would be a fleece. And fleece is actually more abrasive than chenille. So chenille is nice, soft, fluffy, and fleece is a little bit more abrasive. So then you go from chenille, and then from chenille, then you go over to, from fleece, you go over to like a bristle brush, like a very soft toothbrush. So you went from the brush, the cotton wand, to a bristle brush, which is a soft toothbrush. And then you brush that area lightly, again, using their unaffected side first, and then go over to the affected side with the light toothbrush and use that for a little bit. Next one, go with your hands again. So now you're using your hands again, and now the pressure is going to be a little bit more intense. Unaffected side first, then go back to their affected side, a little bit more pressure than you did for the phase 1. A little bit longer even. If the dog can tolerate it, if you can lengthen the amount of time that you can touch that affected area, go ahead and do that. And then you start to introduce temperatures. So you want to take maybe your fleece and you want to dip it in a little bit of cool water, and then put it on their unaffected side and then on their affected side, and get the temperature thing going in there. If they're okay with that, then do the warm water. Do fleece with warm water and do that as well. So that's a phase 2. Again, it shouldn't take you more than 5 minutes at the most. I would do that 3 to 5 times a day, as many times as you're petting your dog. Make it a functional activity and start introducing these materials. And then you can move on to phase 3, which is a little bit more it's not aggressive, but it's a little, the materials are a little bit more abrasive. You're starting with a terry cloth as your material. With a brush, you're going to use maybe not a soft brush, maybe you're going to use something that's a little bit more, has a little bit more oomph to it, like a little bit of a bristle brush. With your hands, instead of a gentle compression, which is what you were doing, you're going to start tapping. So then you're going to take your fingers and start doing some tapping. And tapping is the next step after the compression. So you were doing the compression for phase 2. Now for phase 3, you're going to start to do a little bit of tapping with your fingers. And then you can also start to introduce a little bit of vibration. So there's a totally new sensation.
Yeah.
If you take maybe one of those they have little mini vibration tools, you can start using that. Again, turn it on first. Make sure that you're comfortable, that your dog's comfortable with the noise. Okay, make sure that they're not scared of the noise first. I do all this with the Dremel too. When you're using the Dremel,
For nails.
so I always just turn on the Dremel and leave it there while they're eating, so that they get used to the sound. And so the sound is not scary for them. Then I'll take the tool and start, doing just a little bit. So with the mini massager, I'll start with the non-affected side and just touch them with it so that they know what it feels like on the normal side. And then I'll start on the amputated side, as long as they're comfortable with the normal side. So then I'll introduce that. And then with the temperature, I'll start with cold water. And you can even move up to an ice cube if the dog tolerates it, and then warm or hotter water. Okay, now dogs' body temperatures are higher than humans, so they can tolerate a little bit more heat than humans can. So that's the way I'd progress. And then phase 4, which is really the last phase, would be something a little bit, the material I would use would be something like a burlap instead of the chenille or the fleece. And then as far as a brush would be concerned, I'd use one of those like a bristle brush, like a curry comb. I'd use a curry comb that you would, usually use on short-haired dogs to brush them.
Oh, yeah.
Okay. So use one of those. And then there's also those great friction gloves, they're even gardener's gloves, the rubber ones, because they pull a little at the skin. And that's a really intense type of sensation. That's really good. So you're adding some tension to the skin of the of the wound site, and that, as long as they're healed, that's a really good type of sensation for them to get, because it really helps to define the area where the amputation is, and it helps to clarify that in the brain, which is what you're looking to do. And all of those stimuli are telling the brain, hey, wake up, my body ends here. If there's no longer a limb, this is where it ends. And then the brain starts to relax, calm down, and the pain is reduced. So that's the whole point. So if the brain interprets a missing limb and trying to move the missing limb and interprets that as pain because it can't do it, then the whole point of a desensitization program is to tell the brain that the body now ends here and it can calm down. And that's what it does.
This is so helpful. It seems so simple. And, honestly, when you're describing these materials, we as humans, we take it for granted. We know what these materials do. We've felt them before. We know what the sound of we know what a Dremel means when it's on, but our pets don't know these things. And so, like, one time I had a pet company, they sent us a doggy massager.
Yeah.
And I tried so many ways to introduce that thing to our dog, and he wouldn't use it. He was just terrified of it. To think that something like burlap or chenille, that our dogs would benefit from touching that, it kind of blows my mind. Now, I wanted to get this clear in my head. When would you start doing this protocol? Would it be the day they come home from surgery? Would it be after the stitches come out? At what point can somebody begin?
So I would probably allow the dog to heal somewhat,
Okay.
if if the surgical site looks good, there isn't any infection, there's no redness, there's nothing like that, and it's starting to heal, I would probably start on week 2 after
Okay.
surgery. So just give them a little bit of time to heal a little bit, and then I would start with nothing, it nothing that's going to, I wouldn't go directly on the incision site. I would go around it. So leave the incision site alone. You can certainly use the chenille to go all around the incision site. That's fine. Don't use any of the, I wouldn't use vibration, and I wouldn't use, I guess you could probably use, as long as it's healing well, I think you can use the warm and the cold water cloths are fine. But I would probably stay away from the vibration, and probably anything that tugs on the skin, like the curry comb and the rubber, the friction massage glove, until the stitches come out, because you don't, that's a very fragile area, and you don't want to
Yeah.
cut the skin. But you can certainly introduce soft materials, and the sooner you start, the better. Really, the better.
Okay.
Because the brain is it just needs as much information as possible, and it's completely devoid of it because it's no longer, the limb is no longer able to weight bear. How do dogs feel their environment? They feel their environment through their paws. I make TheraPaw boots, but I love it when dogs don't need it. Because the point is, and a pet owner will call me and say, oh, I want my dog, only their left foot is affected, but I want them to be even. So I'm going to buy one for the right foot so that they're nice and even. And I said, only if your dog is hypersensitive to boots, should you put them on both feet. Always leave unaffected feet open, because the dogs feel their environment through their feet. And it is imperative for dogs to be able to have uncovered feet so that they can feel what's cold, what's hot, what's, where they should step. They feel everything through their feet. So I really try not to cover paws if I don't have to. And so, going back to the site of the amputation, I try not to, I try to flood that environment as much as I possibly can without hurting the site of the injury. So just be careful about that. But just try to flood it as much as possible. If you can get away with doing it 6-7 times a day for a couple of minutes at a time, it's only going to help with the outcome. And, even if you start them on GABA, maybe you can even reduce the amount of GABA that you give them a lot faster and get them off the Gabapentin sooner too.
Yeah, I was just going to ask you how this would interact with anything like gabapentin or amantadine, which is another one they come home with. This is so helpful. I cannot thank you enough for explaining this. Everybody, we will have links and some images in the forum post about this. So please check it out. Don't delay. This is really good information to have when your pet comes home from surgery. And we are just so grateful that you were here today to explain it. Thank you so much.
Oh, it was a real pleasure of mine. And, I was just thinking about one more thing real quick.
Sure.
Anytime that we have a cut or a sting, what happens if we get a cut on our arm, if we get a burn on our arm, or if we get a sting, we don't just leave it. What do? We hold it. We try to massage it, any kind of input to help to re-educate the brain, and just say, and to also feed it a different type of stimulation so that it doesn't feel that pain all the time. So sensory input into an injured area or into that surgery site is so important to help not only to re-educate the brain as to where the body ends, but also, there's only a certain number of pain fibers that go up to the brain. So try to flood them with different type of information will also help to reduce the pain.
This is a good kind of flooding. Usually we hear about it being a bad thing, but this is a good flooding for our pets. Thank you again.
Sure.
We will
Pleasure.
hopefully have you back someday. Thanks a bunch.
Okay. Thanks so much, both of you. Thanks.
Wow, I hope you were taking notes. It's not often we hear such detailed practical tips you can try at home to help ease your pet's pain, really just while you're petting them anyway. So check the show notes for links to the resources we mentioned, and let us know about your experience coping with phantom pain for your dog or cat by posting in the forums or starting a free blog at tripawds.com.
He's a three-legged dog and he's still pretty good. Three-legged dog.
Thank you for tuning in. Subscribe to Tripawd Talk Radio for more pet amputation tips from experts, and claim your free gift just for listeners at downloads.tripawds.com/podcast.
Try